There's a house built out of stone, wooden floors, walls and window sills, tables and chairs warmed by all of the dust. This is a place where I don't feel alone. This is a place where I feel at home. I built a home for you, for me, until you disappeared from me, from you. And now it's time to leave.
Out of surgery now for this is my third day after my VP shunt. As you can see, I'm still a little bit of a mess. My hair here has turned a lovely pink red color, you can see, and that's from the surgery. Right here is where they drilled through my skull. I'll get to see what it looks like today. Apparently when Dr. Lee drilled through my skull, a huge amount of CSF fluid came splurting out, which I guess is a good sign because it shows that I had really high brain pressure. Feeling a lot better today, pain meds are under control. Still quite uncomfortable around the ear and down the right side of my body. You can probably see my catheter here if you follow the bruise line from behind my ear. And you can see it goes down through my chest here. So it's really tender. My stomach area here, I've got a big incision where they fed it through as well. So I've had it. So what happens is that you have here the VP shunt that goes through right into the middle of the brain, into the frontal right ventricle, which is where the CSF fluid can build up. And then what happens is that it then trails along through here, around the back of my ear here, and that's where the valve is. And I have one called the anti-siphon valve to make sure that gravity doesn't allow too much CSF exiting out the brain. So I actually started to realize I could hear my valve going, which was kind of a weird experience when I first heard it. It sounds like a bumblebee. It's like a zzz sound. But I guess that shows that it's working, which is good news. I want to say that my symptoms are better, but I think it's still too soon to say what is better and what isn't.
To the seas, there is a tree as old as me.
So we've arrived in Charlottesville, Virginia. Regarding the brain shunt, I'm having a CT scan in the next half an hour to see whether all the catheter and the tubing and everything in the brain is situated the way that it should be. Completely honest with you, when I first woke up from the surgery, I did feel a great relief. However, the last 2 weeks or so, I've been feeling like my high pressure brain symptoms have been coming back again. Not to the severity that it was prior to my brain surgery, but I've definitely been feeling the pressure headaches have been coming back slowly. Behavioral changes, I've become more irritable. My behavior is starting to mimic like it was before the brain surgery, where I was pretty unfiltered, and I was pretty black and white in a way that I would be talking about things. It's quite strange what the brain does when it's under considerable amount of pressure or it's not in a happy state, and that it can actually affect your personality. So I'm recognizing that again, and it's freaking me out a little bit just because I know it's not me. Some other things that I'm just noticing is that when you go from a sitting to standing position, I'll feel a whole overwhelming flow of pressure in my head that it feels like my scalp's about to blow. But I just think that the pressure setting right now, it's set at 12, which is right in the middle, is just not the right pressure setting for my brain. It's not happy. For some reason, we as EDS patients have these bizarre symptoms post-shunt surgery that normal people don't. One of them being, and thank goodness it's now gone and died down, but was my hearing, where any noise or any voices that I was hearing, everyone sounded like robots. There was like static noise. I can't really describe it anymore, but that. And also the high-pitched ringing, which I get anyway because I have tinnitus, but this was like amplified hugely. And that in combination with the static sound and feeling like you're in a fishbowl because of the echo, it was really, really hard to try and battle with the last few weeks, especially being in a supermarket or other crowded places where there's lots of noise going on. That wasn't fun, but it's now died down, and I think it's just one of the side symptoms that the brain goes through when it's gone through major surgery. Another one I'm dealing with at the moment is the sharp abdominal pains that I'm getting, that we think is from actually the CSF drainage into the abdomen. Normal patients apparently don't get this symptom, but I don't know why we do, but we do. And every time I feel the drainage 6-7 times a day, when I feel like it's draining into my abdomen, it feels like someone's stabbing me in the stomach, and it's really painful. And it causes me to hunch over, like genuinely hunch over, because I'm in that much pain. And I would say I have quite a high pain threshold. I mean, I've had a catheter angiogram before and a lumbar puncture where the local anesthetic hasn't worked. So if I could go through that type of pain and deal with it, then, you know, what I'm saying here is it's pretty uncomfortable. But I'm hoping that with time, it will die down and pass, but we will see. It's like myself with Ehlers-Danlos syndrome, we kind of know our bodies more so than a normal person. We're more in tune. We kind of can feel what's right and what's wrong. And I just have this gut feeling, and I have this feeling in my head that my brain's not really happy right now. It's not as bad as it was, but it's not at the point that it should be. So, and that's why you have these post-op appointments, and that's why, you know, patients like myself, we are giving feedback to specialists like Dr. Liu and other neurosurgeons and other surgeons across the country here that are doing pioneering treatments to patients like myself. That's why we give back the feedback, and that's why they kind of test us and see us. You know, some patient may be put in a lower setting, and some patients like myself will be put in a middle setting, and then they'll see whether we come back and say everything's great and like we're doing fabulous, or kind of feeling like there has been some relief, but it's not the feeling that I was expecting, and I'm still suffering from symptoms. So this whole journey is a learning curve for everyone, for the specialist, for the patient, even for myself, where I'm starting to learn and understand what I know for myself, what my body likes and what my body can deal with, and listening to it when it's not happy. I say not happy, but when it's sick, basically, because it's not able to work or function the way that it should be. So I'm looking forward to today to talk to Dr. Liu honestly about my symptoms and seeing whether he agrees with me that maybe putting my shunt setting at the level 7, which is the one step lower than what I'm at now, can actually benefit me more and make me feel better. So fingers crossed that my scan goes well and that my consultation goes well, and I will update you when I'm back. So I had my CT scan and now we've been directed upstairs and I'm waiting for Dr. Lee to come in for my consultation. So my mum has my medical book ready.
Ready to record.
And this medical book here is like from
Right from January
of 2016. She's like recorded every single appointment, consultation, my symptoms, blood pressure, you name it, it's all in this book. So she's misorganized.
But this is the shunt programmer, and as you know, it works on magnet technology. So this we're gonna put over the shunt itself.
Okay.
And there is a little magnet in here that reads it.
Okay.
So we just set it in there, and wherever it goes should be your setting.
Interesting. Okay. So we're gonna put it one step down.
Yeah. So here, so we can be adequately filmed. So when
wooden floors, walls, and window sills, tables and chairs warmed by all of the dust.
have it set at 110, you feel something?
It's nothing bad. I can just feel like an energy
You
field.
feel it pull
Yeah,
a little bit?
Mm-hmm.
So you come here so you can see that it's set at 110.
Right.
At home.
Double confirm. Yes, so see how the needle has moved to 70.
Okay.
So you're set.
Disappeared from me, from you, and now it's time to leave. And time to die.
So this is after my consultation with Dr. Lee. It went really well, my consultation, and we discussed the topic about lowering the setting on my shunt, which basically means that the pressure in the brain has to be lower in order for the fluid to be drained. So the lower the pressure in the brain, if the pressure builds up and gets higher, then it's drained. So, and I don't know, I just feel, I don't know whether it's just the lighting or anything, but I swear my eyes were not this blue before my consultation, or this like shiny, I don't know, it's weird. The reason why I'm saying that is because they just changed the setting to 70, and I am genuinely feeling like I'm present. I know it sounds weird, and it's not weird, it's just different. And I think if you only have had high pressure in your brain, you'll be able to understand that you constantly feel like you're disconnected from where you are, meaning that you don't feel like you're really here in the present because it's so cloudy, and it's really hard to describe. But once they changed the pressure, I had a huge gushing sound from the back, which was my shunt working, like releasing the fluid, reducing the pressure in my brain. And then I had this really weird whole body experience, which was a huge overwhelming of heat. I don't really know what that means, but my whole body felt like it was burning, which was kind of weird. I then had a click, and I felt a click, and it was almost felt like there was like a huge magnet pull sensation that was going on. And once she reduced the pressure and it was set at 70, I almost felt like when you wear glasses that are blurry for you, and you have that constant blur, right? And they give you a pair of glasses where you can see clearly for the first time. It genuinely felt like that. Like everything just felt a little bit blurry. The colors weren't that great. You know, I couldn't really decipher the lines of objects that well. And then suddenly when she was reducing the pressure, I had this overwhelming feeling like, whoa, I can see everything so clearly. And it was so overwhelming. I actually started crying. And I'll start crying now, sorry. It feels amazing, because this is what normal is supposed to feel like, and I haven't felt normal ever in my life, and for a doctor to be able to help manage the debilitating symptoms that I was going through, and to help combat that, to help try and diminish them so that I can live a life that I can be happy and pain-free, hopefully. Although, as you know, we as EDS sufferers suffer from chronic pain. But basically just feeling a lot better than I was. And it genuinely feels like I'm here in the present. Like I'm here now, and I can see everything so clearly. Everything seems brighter, everything just, it feels exactly like it was after my lumbar puncture. And I just really hope that this setting for me works well, because I'm already feeling like huge benefits. I feel a little bit like I have a little bit of a headache that's going on, but I think what it is just my brain getting used to the bit of a lower pressure. But no, genuinely, I'm like looking at my eyes, and I genuinely think they look way bluer than they were before. I don't know whether it's just me. And I haven't even put a filter on this or anything, but I am kind of freaking out a bit because it just feels amazing.